People would ask me when I was little, what do you want to be when you grow up? I want to be a physician.
The only thing that kept me going in school was really my love and desire to heal.
I remember faking that I was sick and stuff because I wanted my mom to take me to the doctor because I just loved the environment.
When I rotated on cardiothoracic surgery, that's when all of the pieces of the puzzle really came together, and it was another one of those moments in life where I just knew that this is what I was meant to do.
From 0 to 7, I grew up in the landfills over in San Felipe, which is pretty much the outskirts of Mexico. The memories are kind of blurred, but they're really painful.
My childhood was mainly just kind of growing up on my own. I didn't really do any extracurricular activities because, I mean, there was no one to take us.
My parents were migrant farm workers, so growing up we spent afternoons working with them after school. By the time I was a senior in high school, I met my wife Rita and we had a son, so we were teenage parents.
My parents, they came here from Guanajuato, Mexico, didn't go to college. My dad only went to middle school.
It wasn't a very obvious path to medicine for me.
Paramedical definitely will have a big impact for Latino students who come from similar backgrounds as myself.
Having a program like Médico, I think, would be very beneficial to help be like a beacon to guide students along who don't necessarily have mentorship from their parents or don't have family members who have gone through the process. I think mentorship is a very powerful thing.
How's it going? Good to see you.
I actually met Dr. Souza when I was applying for the post-baccalaureate program. I showed up in my nice suit, nervous as heck, and he was the interviewer that day. That's the first day I met him. I felt a strong connection with him from the very beginning.
Food is on its way to where?
Once you're in medical school, yes, you're in medical school, but the struggle still continues.
Even just having someone to be like, you can do it, you can do this, just having someone on your team.
It's kind of tough to ask for help because we're raised with you have to pull forward, you should not depend on anybody else.
This is actually a building where we come and practice all the clinical skills that we learn in school.
But I learned really fast throughout the post-bac that no, we are in a world where we have to ask for help when you need help to grow in order to grow stronger.
Getting someone to help you with your MCAT prep, because that is just scary in itself.
If I had done the MCAT by myself, I feel like after the first try I would have been, well, I can't do it, so let me change careers. Cambié los nombres. Clínica Tepati definitely gave me hands-on experience of not only learning the science of it, like doing the blood pressure, you also do the patient interaction. You can be a really smart physician, but if you lack that communication between patients, you won't get much out of them. They'll just sit there and just nod. Igualmente, ojalá que vayamos.
Having made it to this level where I'm working in the hospital, there is a huge need for Spanish-speaking, culturally competent physicians.
There is a disparity out there, and we need to address it.
My grandpa, he's one of the main reasons I'm here. He struggled with diabetes for as long as I can remember. He passed away during my junior year of college, so just seeing how much medicine really impacts an entire family, that just motivated me to want to do primary care because I can treat, the baby and the grandpa.
Even when I go now to my doctors, I always try to look for someone that looks like me or speaks like me, and it's kind of hard to find someone like that.
More importantly, I think, is to bring, Latino students that will treat any race with the same heart and love.
I think before it even starts, like Permanente, just announcing it or just talking about what it is. I mean, I wish I can sign up already.
Just helping me visualize that path. You would have saved me a lot of stresses in between. I would have gotten to medical school a lot younger. I would have been productive as a physician a lot younger.
My dad has told me that, I would have loved to go to college, and so to see you living your dreams, it just means so much to me.